Welcome everyone. Today we are going to discuss regarding Graves' disease, and let's go into details about the Graves' disease. Graves' disease is a very important topic for all exam point of view, and we will discuss all the important factors in Graves' disease: the pathogenesis, the clinical features, the diagnostic overview, and the management of Graves' disease. So, what is Graves' disease? So, Graves' disease is Graves' disease is a very common cause of endogenous hyperthyroidism. In fact, it is the most common cause of endogenous hyperthyroidism. And here some important facts are there. Graves' disease, here it is an autoimmune disease. There is a genetic association that is characteristically seen. So here you will see some kind of a autoimmune reaction, and genetic predisposition is there, and individuals with family history and also HLA-DR3, HLA-B8 association is being noted. So very commonly asked, HLA-DR3 and HLA-B8 association. Apart from that, various infections, stress, smoking, female gender, these are all other predisposing factors. And there are various autoimmune markers, autoantibodies that are found over here, and various cytokines are there. Various cytokines are elaborated because of this autoantibody formation, which leads to inflammation, severe inflammation. And here there is a basically there are a set of antibodies. The most specific antibodies is thyroid receptor antibodies. So it basically increases the sensitivity of TSH to TSH receptors. So it augments the hormone release, augments the hormone synthesis of thyroid hormone synthesis. That is the important feature. Apart from that, TPO antibody is there, thyroglobulin antibodies, but out of these, thyroid receptor antibodies are more specific to Graves' disease, so which increases the sensitivity of TSH to TSH receptor, thereby augmenting the T3 and T4 release. It is not uncommon to get stimulating and inhibiting in immunoglobulins in the serum of the same patient. That is also common in this patient. So Graves' disease is autoimmune condition, and here you will see more commonly seen in females because it is autoimmune and HLA association is being noted. And here you see a typical triad, and here the triad will be basically there is a goiter, there is a ophthalmopathy, there is a pretibial myxedema. The pathogenesis basically lies because of this autoantibody production, and there are inflammatory infiltrate autoreactive T cells which infiltrate extraocular muscles and various other tissues. And here the pretibial myxedema, the myxedema in and around the leg. So here the lower extremities. This is typically due to the increased synthesis of glycosaminoglycans such as hyaluronic acid and chondroitin sulfate. Also, it has been noted that the affected tissues have more of fatty infiltration. And what will be the clinical features we discussed? Clinical features include the pretibial myxedema, the goiter, diffuse thyroid goiter, and there is a exophthalmos. So these are the key features. As you can see, the exophthalmos of proptosis is quite visible. Apart from that, all classical signs of hyperthyroidism the patients will have, like increased heart rate, moist skin, palpitations, everything will be there. And histology will show some typical changes. There is an increased papillary hyperplasia of thyroid gland with a lining, epithelial lining thrown into papillae. And you will see some kind of a scalloping will be noted. As you can see, the scalloping, the vacuoles that are absorbed over here. So you can see the vacuolar absorption. The colloid at the periphery of this papillae will be absorbed, leading to some vacuolar changes. This is called as scalloping, which is generally seen along the edges of the papillae. And papillae are lined by hyperplastic columnar epithelial lining. And also you will see some kind of a dense lymphoid infiltrate, predominantly of T cells, B cells, plasma cells, that will be noted over here in Graves' disease. So these are the key factors of the Graves' disease histology: papillary hyperplasia, scalloping of the colloid, and lymphoplasmacytic infiltrate in the stroma. And how to approach the diagnostic feature. And here you can see uh, again the papillary features and scalloping are very well visible. Apart from that, now what are the lab findings? Lab findings, you will see increased T3 T4. T3 T4 will be very high with almost negligible TSH will be negligible, T3 T4 will be consistently high. And auto antibodies, detection of auto antibodies is quite specific to the Graves disease. And so these are the key diagnostic features. The management overview, how to manage: you can give antithyroid drugs like propylthiouracil, beta blockers, and you can also do the thyroidectomy, and radioiodine therapy also can be done for these patients. So that's all about the Graves disease, what we discussed so far. So Graves disease, we discussed that there is a hyperthyroidism, there is a diffuse toxic goiter, there is a pretibial myxedema and exophthalmos. And we discussed the three autoantibodies which are seen, that is and thyroid receptor antibodies, anti-thyroglobulin antibody, and anti-TPO. And we discussed that the most specific antibody is thyroid receptor antibodies, which causes increased sensitivity of TSH to TSH receptor, leading to increased T3 T4 release from the thyroid parenchyma. And we discussed the histological feature: peripheral scalloping, papillary hyperplasia, and lymphocytic infiltrate. And there will be characteristically increased T3 T4 with the decreased TSH level. These are the key features of Graves disease. So that's all for the Graves disease. Now I will stop sharing, and now we will keep it open for basically any kind of questions that you have. So you are basically free to ask me any kind of questions that you have, any kind of questions that you have. So, in case there is no questions, so you can always connect to me through various mode. Like you can connect to me through the WhatsApp, and you can connect us through various channels in Instagram. And apart from that, we are also there in Facebook page and Facebook groups also with the same name, that is Pathology Navigator. And also you may connect us for any kind of a regular pathology teaching, as well as any kind of a 10 crash course. If you need if you need to enhance your learning and you need to pass your course in 10 to 15 days time, we have some specific crash courses. So please join us if you are feeling burnt out, or if you want regular coaching to enhance your performance. So please feel free to connect us for any kind of a pathology related coaching for any kind of exam, whether you are doing it for NEET PG, USMLE, you are doing it for PLAB, FMG, or you are a student of MBBS professional or a MD professional. So for any kind of a pathology coaching, for academic, enhancing the academic performance, for regular pathology tutoring, and also for any kind of a doubt clearance, one-on-one questions discussion. So we are open for that. Thank you, and we'll see you in another session very soon. Bye bye for now.